So hello, I'm James. Now, some of you who saw my first video remember that I was talking about just getting started with fitness, and the most important thing is just to get out there and do something. Now, you saw me just walk around the park, and to be honest, I could have run or jogged slowly, but I was trying to make the point that when you start with a New Year resolution of getting fit, just get out there and just do it. Don't talk about it, don't think about it, just do it. So that's what I did. Now, in this video, I wanted to talk more about some things you should be aware of when you start an exercise program. So maybe you're thinking of joining a gym and you want to get a good start. So one of the things you want to be mindful of is your general health and wellness. So to give you a bit of backstory on me, I used to work as a fitness instructor in my 20s. I did it for most of my 20s. And one of the things we used to do when new members used to join the gym, we used to give them an induction. And in that induction, we give them a screening questionnaire. So we'd just be looking out for things like the basics, age, weight, blood pressure, any heart problems, anything like arthritis, diabetes, joint problems, anything that we needed to be aware of. But also, if there was anything of any concern, we'd suggest, look, go see the doctor, just get the all clear before you start. So someone, for example, who's got very high blood pressure, maybe sort of 180, 200 over 110, 120, anything like that, or 170 over 120, anything like that, we'd say, look, just go see a doctor, get whatever medication you need so you can get it under control, so you can get started. Now, obviously, gyms want to cover themselves as well, so they wouldn't want someone to start training who's not fit. So some of those things you can do yourself. I'm going to show you how to take your blood pressure and a couple of other things. So for me personally, my stats, well, I'm 5'10". I'm going to take my weight. I'm going to show you the blood pressure so you can see. So there's some of the things, the basics you just want to bear in mind before you start. I've got one of these little blood pressure monitors myself. I bought it from Boots for about £20. It's a good idea to keep one at home if you have high blood pressure, so you can keep an eye on it. Also, you want to get it checked when you're relaxed, because you want a resting blood pressure. So avoid taking it after eating, because that can affect the results. So you want to probably take it when you're sitting down and relaxed, maybe first thing in the morning. You're more likely to get your resting blood pressure result. Okay, so to take your blood pressure, what you want to do is attach the monitor to your arm using the cuff. Now you see that dot there? This says ART, which stands for artery. Now that should line up with your middle finger. And you want to get the cuff, you don't want it too tight, you don't want it too loose. You just want it to be kind of snug on your arm. So you should just be able to get your finger, the tip of your finger underneath it. Also, as I mentioned before, if you've eaten beforehand, that's going to affect the reading. And anything like tea or coffee, or if you smoked before it, that will affect the reading. So try not to do anything like that within an hour beforehand. And also, if you do it after exercising, it's pointless because your reading's going to be higher. So make sure you haven't been active before, because you want to take a resting blood pressure. So just make sure you're sitting down supported. Don't cross your arms or legs. And yep, that's it, away you go. So I got 147 over 87, pulse 75. So that's a little bit up. I'm normally about 135 over 84. something like that, and the pulse is normally about 60 resting, so 75 is a little up, but I suppose been moving about doing this, so it's still okay. It's not too bad. Would like it a little bit lower, to be honest. So one of the other things you want to check is your pulse. Now, when you take a blood pressure reading like we just did, you'll notice that it showed a pulse figure, and that can go up and down along with your blood pressure. So often what happens is when your top figure, the systolic blood pressure, is high, because you've been running around, your pulse is also high. So as that pulse comes down, the systolic will normally come down. It's the bottom figure that's also pretty important. That's the one that tends not to go up and down so much. But with the pulse, it's definitely worth knowing what your pulse is. Now, if you've been running around and you check your pulse, it's going to be high. But the thing to look for is when you stop exercising and you stop doing anything strenuous, your pulse should come down. So if it stays high, like it's staying at 100, and you're just sitting around having a cup of tea, that's not a good thing. It means that your heart's having to work hard even at rest, which means you're not going to be very fit aerobically. So one of the things you can check for is when you're exercising, after you've finished, notice how quickly it comes down. If it comes down quickly within a minute or so, you know that your heart's working well. If it's staying high, and sometimes it can stay very high for a prolonged period of time, that's a bad thing. So I'm going to show you a couple of places how you can take your pulse yourself. And the best thing you can do is get one of these little stopwatches. I bought this one here for a few pounds on eBay. And what you can do is time your pulse for about 15 seconds. And then what you do is you times it by 4. So you're going to take 2 fingers like that and put them on your neck and press till you can feel a pulse. Start a stopwatch, let it go 15 seconds, and then whatever that figure is, you times that by 4. So I did this earlier and I got about, depending, 15 to 20. So that would be 60 to 80 beats per minute, depending on what I'm doing. If I'm exercising, it's going to be a lot higher than that. So that's what you can do. The other place you can take a pulse is on your wrist. I'll show you how to do that in a sec. Okay, so to take your pulse on your wrist, what you do is take 2 fingers like that and put them on your wrist just above where your tendons are. So you should feel a sort of tendon there, and just above that, 2 fingers, press in until you can feel a pulse like that. What you don't want to do is use your thumb, because that has its own pulse. So that's how you do it. If you're out running, it's quite handy. You can just 2 fingers on your neck or 2 fingers on your wrist and take a pulse that way. So just to recap, it's worth buying a stopwatch because you're going to be using it for testing your pulse, and also if you're out doing any kind of cardio, you want to know how long you've been running or how long it takes you to run a certain distance, definitely have a stopwatch on you. And this one I can just literally hang it around my neck, and yeah, it's really useful to have one. The other thing, going back to just the other thing to recap, was if the heart rate stays really high, and it's worryingly high for a long time. This happened to a friend of mine. He was working very, very hard on a very physical job for a very long time, a lot of years, putting in crazy hours. Went to the doctor because he didn't feel well, and they gave him one of those stress tests on a treadmill, and his pulse stayed high. Like, this was an exceptional case. It was like 180 after half an hour after the exercise, and it wouldn't come down. He got diagnosed with arrhythmia, and he's now treating that, and he's getting a lot better. But if you have anything like that that is worrisome, like with a high pulse that's staying high, go see your doctor before you even attempt to do any exercise, because you could have something that needs treating, like an arrhythmia. So just wanted to put that out there, because that's very important. Okay, so now we've got blood pressure and pulse out of the way, it's time to check my weight. So I'm just going to do that. Let's see what the scales say. 191.8. So that's coming up 13 stone 9 3/4, or 87 kilos. So we've got 3 different weight settings on this scale, which is pretty useful. I've actually got another pair of scales here, the old type with the dial. So I thought I'd just jump on them just to test for accuracy. So you can see. Let's just zoom in a bit. So that's saying about the same. about 87-ish kilos. So yeah, there you go. These scales stay the same. Just a couple of tips when you weigh yourself. I know it's going to sound a bit daft, but just make sure when you jump on the scales, you're always wearing the same thing. So, for example, I've got this t-shirt, which is pretty thin, a pair of tracky bottoms, which are pretty thin, and some socks. So obviously, if you're wearing shoes one time and not the next, it's going to affect the reading. Also, what you wear as well. Jeans are pretty heavy, so if you wear jeans one time and a very light pair of tracky bottoms, the next time it's going to affect the reading. So I thought I'd just put that out there, because if you always make sure you wear the same thing, you're going to have accurate readings and it's not going to be misleading. And the other thing is, always put the scales in the same place. So you want a hard floor, like kitchen or bathroom, and about the same place so that they're level. Because when you're talking about half a pound or 0.1 of a kilo, it's going to make a difference, those two little things. So I thought I'd just mention them, because I know they're really obvious, but it does make a difference, and every little bit counts, doesn't it? So, okay, so now we've got the screening out of the way, it's time to talk about goals. So as far as my goals, what I would like to do is, first of all, start losing some body fat and get myself aerobically more fit. So when I'm talking about aerobically, I'm talking about cardiovascular fitness. So some of the things I like doing is, I like a bit of running. I say running, more like jogging. Jogging, cycling and swimming. So I'm going to be concentrating on those three. There's other things you can do. For example, if you're into classes, you know, by all means do that. I'm going to concentrate on those three, and I want to improve my flexibility as well. So lose body fat, increase flexibility, increase cardiovascular fitness. Now, as far as a target weight, I don't really want to talk too much about that, but as I said from the beginning, little steps, small goals at a time. So for me to lose a kilo at a time, that'd be great. You saw me step on the scales and I was 87 kilos. I would honestly like to be 77 kilos. That's what I weighed when I was 20. I had quite low body fat then. Not excessively low, but I was in shape, and that's what I'd like to get back to. So yeah, I mean, I'm going to just see what I can do, kilo at a time. So as far as yourselves, you know, I know I'm talking about my fitness journey, but it's that time of year. It could be your fitness journey as well. So think about your goals. Just think about goal setting. Think about what you want to do, and a bit at a time. And just measure it as you go along. And talking of measuring it, one of the other things we used to do as instructors was fitness testing. So in my next video, I'm going to talk a bit about that and show you some of the tests we used to do. And it's a good way to monitor where you are. So you've got a baseline. And then as the months go by, every few months you do another test and you can see how you're improving. So some of the things we used to test were, for example, was aerobic fitness test, flexibility, strength test, lung function. So I'm going to show you some of those in the next video. And yeah, over the next few months, hopefully you'll see this not very fit ex-fitness instructor get a bit fitter. So I really need to do something because I left it long enough. But anyway, check out the next video. It's going to be about fitness testing, and I'll see you in that one hopefully. So bye for now. Oh yeah, and I nearly forgot. If you like the video, please give me a like and subscribe, and I'll see you in the next video. Laters.